Hello there. Welcome to my show, COVID-19 update by Heerak for March 2nd, 2021. It's the 11-month anniversary show. Yes, this show started last year, 2020, on April 2nd, and it's been 11 months since this show has been running. For many months, it's been a daily show. So you could go to YouTube channel, Heerak Christian Kim for Congress, YouTube. Just type that in into Google, and you can see all the episodes from April 2nd till now. Recently, we stopped being a daily show because COVID-19 daily deaths are consistently over 1,000 in United States every day. And uh, we understand what COVID-19 is, and we understand by and large how we can escape COVID-19 infection and death. So a lot of the information that I provided from April 2nd until now uh, will help you and your children and your family survive COVID-19. So you can go back and watch the reruns from April 2nd, 2020 until now. And you can follow the guidelines that I provide that will help you survive COVID-19. Yes, thousands of Americans are dying every day from COVID-19 right now. So I'm predicting, and I'm Heerak Christian Kim, independent candidate for U.S. Congress in Virginia's 8th District. I may run as a Republican in the primaries in 2022, but that's like over a year away. So right now I'm running as an independent candidate for U.S. Congress in Virginia's 8th District. And that is Arlington, Alexandria, Falls Church, and Fairfax County in Northern Virginia. Arlington County and City of Alexandria border Washington, D.C., the capital of the United States of America. And so I created this show to save my district residents, Virginia's 8th District residents, from COVID-19 death. And this show has been highly successful in helping Virginia's 8th District residents survive COVID. Um, and you know, this show is on YouTube channel. So people around the country can see this show in the United States. And in fact, people around the world can see this show. So this show has been instrumental in helping a lot of people um, understand COVID-19 better and survive COVID-19. Um, yes, I am a registered nurse in the District of Columbia, and I'm also a registered nurse in the state of Virginia. And my state of Virginia registered nurse license is a multi-state license. So I can practice as a registered nurse in over 30 states, I believe, with my Virginia license. There's a compact agreement. And I am a nationally certified clinical nurse leader, CNL. I received my master's education at Georgetown University in Washington, D.C. It's a master's program that's 2 years long, very intensive. Um, and I graduated in August 2020 with a cohort, clinical nurse leader cohort of around 25. And so many of us are working now at hospitals. I'm working at Virginia Hospital Center, which is in Arlington, Virginia. So if you come to Virginia Hospital Center for treatment, you may see me working as a nurse, and I may take care of you as a patient. I do admit patients directly from the emergency room. So if you have a problem breathing or any kind of emergency condition that brings you to the emergency room, at Virginia Hospital Center. I may be the nurse that who admits you to the hospital unit. Uh, and I may be asking you questions that are admissions questions. So as a registered nurse, I admit patients um, from emergency room. I admit patients from directly from nursing homes. Um, I admit patients into the hospital unit from uh, PACU. So after patients have surgery, they go to post anesthesia care unit, and then I receive patients directly from that to our unit, and then I take care of you. So yeah, if you have an operation procedure that is planned, or an emergency procedure, or if you come directly to the emergency room, you may see me admit you to hospital, your hospital bed, hospital room. So I'm a working registered nurse at Virginia Hospital Center. It's a very good hospital in Virginia, in Arlington, and I'm very happy to be working at Virginia Hospital Center. So if you're a nurse watching this show and you're looking for a hospital to work at, I'd encourage you to come to Virginia Hospital Center. Um, yeah, I am in the registered nurse residency program. That's generally 1 year long for nurses who have graduated and are uh, are entering the hospital as new nurses in the Virginia Hospital Center. So if you graduate from a nursing school and you're looking for a very good RN residency program, Virginia Hospital Center has a very good hospital residency program which supports you. I would encourage you to apply. You come from any state in America, and Puerto Rico and Guam and U.S. territories as well. So if you're a registered nurse, I would encourage you to think about applying. But anyway, yeah, so yeah, I am a registered nurse and I'm a clinical nurse leader. Um, I passed my clinical nurse leader national certification exam uh, in July of 2020, 1 month before my graduation. I was the first one to pass that exam at Georgetown University's clinical nurse leader cohort 2020. And I actually was the first person in my cohort to pass the NCLEX RN exam to become a registered nurse. Hi, everybody in my program. I love you guys. So many of us are working as nurses right now. Uh, and so, we're doing good. I treat all kinds of patients, including COVID-19 patients. I've treated, and yeah. So working as a nurse, there's so much to do to help people, and it's really good to see people recover. And one of the greatest things about working at Virginia Hospital Center, and I live in Arlington County, and Virginia Hospital Center is like 2 miles away from where I live in Arlington County, is that you're kind of treating and helping your neighbors. A lot of the patients who come are from Arlington County, Alexandria, Falls Church, and Fairfax County, and some from Washington D.C. and Maryland as well, like Montgomery County and Prince George County. Uh, and so they're like neighbors. So that's one of the greatest things about working at Virginia Hospital Center. And we also have patients who come from far away places, Fredericksburg in Virginia, in Richmond in Virginia. I help patients who came from Pennsylvania, from Rhode Island, North Carolina, different states, so it's a good hospital. So we have patients from different states as well. Um, I was planning to go to CPAC, Conservative Political Action Committee, uh, 2021, but they moved that from, I guess, Washington, D.C. to Florida. And, I work as a nurse, so I'm a full-time nurse, and I could have taken off for CPAC, but I figured, you know, um, you know, right now I'm really needed here in Virginia Hospital Center to help patients. You know, last week we had you know, full capacity, and often it's full capacity at the hospital. So, so you know, nurses are needed, and so I figure, you know, it's not the election year really, 2021. Next year, 2022 is election year, so I could always go to CPAC in 2022, which is election year, and hopefully it's going to be in Washington D.C. If it were in Washington D.C., I would have gone, but it's in Florida, and you know, I have to take off from work, you know, to go, like probably take off 1 week from work, and I didn't want to do that. Um, and so that's why I didn't go to CPAC in Florida. And you know, also there's a question about how safe it is to fly. You know, I don't currently feel very comfortable flying. No offense to all the airlines. I love flying. You know, I travel the world. I've been to Europe over 30 times. And I've seen basically almost every country in Eastern and Western Europe, and Northern and Southern Europe. So I love to travel. I love to fly. Um, but you know, as a healthcare worker, you know, I understand that there are dangers. COVID-19 is a droplet uh, and also airborne virus. So if you're 6 feet away, um, generally, you know, if it's droplet, you can, you know, you can survive infection theoretically. Although, you know, things can be different, right, from case to case. But in airborne cases, if you're in the same room with a patient who has a COVID-19, you can get infected even if you're further away than 6 feet. And most masks don't work with patients who have COVID when it is airborne, aerosolized. You know, like when patient achieves COVID-19 virus lingers in the air and can travel floating in the air. So most masks don't work. That's why nurses who treat COVID-19 patients wear N95 respirators, and they have 95% chance of protecting the nurse. I mean, there's a 5% chance you can still get it. So nothing is foolproof in life, right? All the COVID-19 vaccine, none of them are 100% foolproof, meaning even if you have COVID-19 vaccine, and even if they work, there's always chance you could get COVID from someone who has COVID-19 because they're not 100%, right? They say they're like 85% effective. That means there's 15% chance you can get it, right? That's what it means. So all the vaccines out there for COVID-19 are not 100% effective. Nobody's claiming that. Pfizer is not claiming that. Moderna is not claiming that. Um, Johnson and Johnson are not claiming that. I think Johnson and Johnson claims that they're about 85% effective, which means 15% chance of getting COVID. I mean, and other vaccines are like that as well. So it's not like just Johnson and Johnson. And your whole world can change. Yeah, your the facade of your world can just disappear. You know, because you think the COVID-19 vaccine will protect you, but it doesn't. So, you know, Plato talked about how reality is not what you see, but reality is beyond what you see. Meaning, what you see is the shadow of reality. Meaning, uh, yeah, in the beginning you look at it and it looks like there's an image, you know, that you can see, but then when you peel away the image, there's the reality. And so that's what we call Platonic thinking. And so Plato and Aristotle, they explain that true reality is not what you see. What you see is only shadow of the true reality. And when you think about your life, right, you know, there is the you that you present to other people, and there's the real you that not many people know, right? And so, you know, just looking at yourself, you understand that, you know, the presentation of yourself, even in social setting, is not necessarily the real you, you know. And so the image of reality is not really reality. Do you see what I'm saying? You live in a mirage in a uh, world that is not totally real. And with COVID-19, it's like that as well. Um, to a certain extent, the images that you see, the safety that you feel when you get vaccinated, or the safety that you feel when you wear a mask, that's not 100% real. Because as I said, even N95 mask is not only 95% effective. There's 5% chance you can get it. And that's what the makers say. That's why it's called N95 mask, not N100 mask. And none of the vaccine makers are saying that you're 100% protected. So what we understand about reality is that you can peel away the cover, and then there is this kind of unknown green space. Yeah, you see the green space that you don't understand. And that explains why we have 2,000 deaths per day. Obviously, Center for Disease Control wants 0 death per day. I'm sure politicians want 0 death per day because death is not good for politics, right? Um, and healthcare workers don't want 0 death per day because we care about your life and we don't want you to die. But despite what we want and wish, 2,000 are dying every day in United States of America with all of our science, with all of our technology, with all of our knowledge, all of our internet and specialists. We have 2,000 Americans or more dying every day from COVID-19. What does that tell you? That means we're failing. Obviously, we're failing when you have 2,000 people dying every day, right? Right now, that's like right now. Right now, like there are 2,000 or more people dying every day in United States of America. We as a country are failing to protect our citizens from COVID-19 death. President Joe Biden is failing to protect COVID-19 death hitting American citizens. We're failing. And I know President Joe Biden wants to kind of resort to talking about the vaccine to divert attention from his failures as the president. And President Trump failed as a president as well. And both President Trump and President Biden are failing uh, in terms of COVID-19. And obviously, the proof is in the death numbers we see. You know, 2,000 or more are dying. So, so we understand what that means for United States of America, for all of us who are here watching this show right now. Um, yeah, because it's what the media presents, and I don't believe in the liberal media. What the liberal media presents uh, looks like a holistic approach to solving the problem. But if the liberal media knew what it was doing, we won't be having 2,000 plus deaths 11 months from when it originated, right? There should be 0 death now. What does it mean to solve a problem, right? You're not solving a problem when 2,000 American citizens are dying every day. That's not solving a problem. President Trump failed. Let's be honest here. I like President Trump, but you know the truth is the truth. President Trump failed. Well, despite his warp speed vaccine, he did succeed in creating the warp speed vaccine. He failed to stop the death, and Joe Biden failed to stop the death as well. Right? That's just it's just a fact, and that's because what you see is a mirage, right? Because what you see doesn't really explain the reality that exists, right? The liberal media likes to present a reality where everything looks good without holes, everything looks good without any problems. You know, everything is packaged as if it's perfect. You know, vaccine will solve the problem. Vaccine will get us to go to normal life. You know, vaccine will return us back to pre-2019, pre-COVID-19 life. And that's just not true. And that's why I don't believe in the liberal media. They just lie. Vaccine will not bring us back. You know, let's look at tuberculosis. There's a tuberculosis problem in the world, and it's growing. And now there's a multi-drug resistant tuberculosis, which resists drugs, meant to cure or help tuberculosis patients. Because viruses, they mutate, right? Viruses mutate to overcome the drugs because they're living organisms and their biological dictate is to survive. And so tuberculosis mutates to overcome drugs that are uh, given to patients. And when the tuberculosis mutates, and then it travels to other individuals who are infected with multi-drug resistant tuberculosis can't be treated with those drugs. So they have to find new ways of treating them. And then tuberculosis will find new ways of overcoming them. So uh, you got to remember viruses mutate, they change to overcome drugs or whatever is thrown at them. And so tuberculosis gives us a good example of what a virus can do. And COVID-19 is a virus. Uh, it's kind of like tuberculosis in that it is infective, highly infective, and it's airborne, but it's more deadly than tuberculosis. COVID-19 kills far more at a faster rate than tuberculosis, which is the big worry. Tuberculosis hasn't gone away. So there's no reason for you to think that COVID-19 will go away. Tuberculosis is also a virus. Um, and COVID-19 is a virus. Um, yeah, don't think that COVID-19 is going to disappear. That is not scientific way of looking at it. Since COVID-19 came to America, there has not been a day without COVID-19 infecting many, many people. So there's no reason for you to think that it will go away. It's not going to go away. Just like tuberculosis hasn't gone away. Like if you want to go as a student to Arlington Public Schools, you have to be tested for tuberculosis. And if you show signs and symptoms of tuberculosis, you can't enter the classroom because there's a danger of infecting other students. In the same way, COVID-19 is highly infected. If there's one student with COVID-19, that student can infect the whole classroom. That's possible. And that's why there's a problem with opening schools. As you know, I'm Heerak, Christian Kim, independent candidate for U.S. Congress in Virginia's 8th District, and I oppose opening schools right now because, number one, we don't really have vaccines that are 100% guaranteed to work in children to prevent them from COVID-19, right? Number two, we don't even have 100% foolproof vaccines for adults. Johnson & Johnson vaccine, which just got approved, is what, 85% effective, they say, at best case scenario. That means teachers who get Johnson & Johnson vaccine can get COVID if he has or she has students who have COVID, right, in a classroom. I mean, you're not going to let tuberculosis students into your classroom, right? And they get rigorously tested. So why are we letting students come into the classroom without rigorous testing for COVID-19? Right? Does that make logical sense to you? I mean, as you know, I worked for Arlington County Public Schools and Arlington Department of Health as part of my master's program at Georgetown University in public health. And I know the leaders in Arlington County Department of Public Health. I know the top person. I know the department heads. I've worked with them, together to improve public health in Arlington County, specifically with children in school settings. I've worked alongside school nurses at Yorktown High School, Washington and Lee High School. I guess they changed their name. You know, I've worked with all these different kinds of nurses in elementary school, middle schools in Arlington County. So I know what the nurses are dealing with and how tuberculosis is treated with utmost seriousness. And so it just doesn't make sense that COVID-19 is not treated seriously, right, in Arlington County. And I think it goes against the science, it goes against the public health mandates and the research in public health. I think it is dishonest and unethical for public health experts to allow schools to open, knowing what we have done with tuberculosis to prevent spread. We're not using the rigorous metrics that we use for tuberculosis, when in fact COVID-19 is far more deadly and far more infectious. We're being more lax and we're opening schools. One of the reasons is because Joe Biden is a politician and it just sounds good to him to open schools, you know? So he's throwing away what is important for public health, which is to protect life. And basically, as the president of the United States, Tin Man Joe, my nickname for Joe Biden, was Tin Man from Wizard of Oz. For those of you who are Generation Y or Z who haven't seen Wizard of Oz, it's a classic. You know, I would encourage you to see it. It's a fun show, fun movie. But you know, Tin Man in Wizard of Oz doesn't have a heart, and that's why I call Joe Biden a Tin Man Joe. This is a career politician, and he doesn't have a heart. He's just going to systematically go and do what is politically expedient for him, without really regarding what's important in terms of life, you know, or people or families, you know. And you know, so far since being sworn in as president, Tim Manjo has proven that he's not going to raise the minimum wage. As you know, I support raising minimum wage to $15 an hour because it's unfair for American workers to be paid less than $15 per hour, because you cannot survive on less than $15 an hour in current American economy, even in 2020, 2019, 2018. It should have been done a long time ago. You know, Tin Man Joe, you know, he doesn't have a heart. He's not going to push to raise a minimum wage to $15. He doesn't want to cancel your student debt, right? He's like, oh yeah, I'm going to cancel like $10,000. I'm like, geez, that's a drop in the bucket. If you go to community college and go to George Mason University, which is a state university in Virginia, you will have far more than $10,000 in student debt in 4 years of your education. Um, and Tim Manjo's like, oh, I'm just going to cancel $10,000. I mean, you know, and a lot of people go to graduate school and they're going to have more student debt in graduate school. You know, Tim Manjo doesn't really understand the need of American families struggling during COVID-19. You know, he's Tin Man Joe because he doesn't have a heart. He's insensitive to the suffering and needs of the American people. And so that's why, I don't like Tin Man Joe because I don't think he cares. I mean, Democrats control the House, Democrats control the Senate, and we have a Democratic president, and he's not going to raise your minimum wage to $15. What a hypocrite, right? You know, all that talk about minimum wage, and he was just lying through his teeth, Tim Manjo. He doesn't have a heart. He doesn't care about working class families in Arlington County, working class families in Alexandria, working class families in Falls Church, working class families in Fairfax County. And it is unfair that with all the power he has in the Senate and the House and the presidency all being Democrat controlled, he's not going to raise the minimum wage. I mean, how can you say he's pro-labor? How can you say he is pro-working class family when you see this? I mean, geez, you know, you can't. After a while, you have to face the truth, right? You can't be lying to yourself, right? The man doesn't want to raise minimum wage to $15. I mean, come on. I mean, you're going to jump backwards and forwards to defend Joe Biden because he's a Democrat, but he's not going to give you $15 an hour wage, minimum wage, and he's not going to get rid of your student debt. I mean, geez, I mean, you're going to be like a slave and be loyal to Joe Biden. It doesn't make sense to me that you're like that, right? If you are like that, hopefully you're not like that. Yeah, so, you know, right now we are facing a reality of what we see, but what we see isn't real. You know, what we see isn't real. You know, Joe Biden is not going to raise minimum wage for $15. Joe Biden is not going to get rid of your student debt. Joe Biden controls the presidency, and Democrats control the Senate and the House. They're not going to do anything to help working class families, really, right? It's just like having Donald Trump as president, except you just have a Democratic guy who's president, right? Nothing's changing for you and your family. Nothing's changing, right? Um, Under President Trump, you got two stimulus checks for COVID-19. And probably, you're gonna get similar thing under Joe Biden, right? Nothing's different. Like had Trump been president, same things would have happened for you and your family as Joe Biden. I mean, geez, how can you support that? You know, um, I mean, you're a slave, right? If you're happy with Joe Biden not raising minimum wage to $15 just because he's Democrat, I mean, you're nothing but a slave. You're just supporting a guy to be in power as your slave master. Um, because for you, that's, you know, um, having a Democrat guy in presidency is more important than actually having your own life become better and you getting paid what you should be getting paid, like $7 plus $7 to $8 minimum wage per hour. When you're like engaged in heavy, difficult work, I mean, geez, you're like working like a slave. I mean, in real dollar terms, right? I mean, they probably paid indenture service more than that, 200 years ago. You know what I mean? Um, Even slaves got 3 meals a day and roof over their house. Like you're working for, and this is in the slavery plantations. You got 3 meals a day and you got roof over your head, right? Now you're working, and many people, they can't even have roof over their head for minimum wage is like $7. What is it, 50 per hour? I mean, they can't support their children. I mean, they can't feed their children properly. So how is that better than slavery, in terms of you being able to have roof over your head and food 3 meals a day? How is that? You know what I'm saying? What I'm saying is um, you're allowing Joe Biden um, to get away with not raising minimum wage. It's like you resigning yourself to be an economic slave, right? I mean, there's no difference, right? If Donald Trump is president now or Joe Biden's president, there's no difference for you. How is your life better because Joe Biden is president? No, your life is not better. Your minimum wage hasn't gone up. You see what I'm saying? And so that's why, let's face the reality here. The reality is not what you see. Reality is what's beyond what you see. You see what I'm saying? Um, Yeah, and that's why I'm encouraging you to vote for me, Heerak Christian Kim, for U.S. Congress and Virginia's 8th District because I will get things done. Um, it's not a political party issue, right? I mean, Democrats obviously are not raising minimum wage to $15, even though they control the Senate and control the House, right? They don't want to do it. All these senators and House of Representative members, many of them are millionaires, right? They don't want to do it. They don't want to help you. And these are Democrats in the Senate, Democrats in the House. They don't want to help you and your working class family. That's what, I mean, it's clear, right? I mean, I'm not saying anything that you don't know. That's why you need to vote for me, Heerak Christian Kim, because Tom Bayer is not helping you raise your minimum wage raise, right? I will get it done. I'll go to U.S. Congress and make sure your minimum wage gets raised. Um, and so, election is November 8th, 2022, right? The proof is in the hand, right? I mean, geez, people say, oh, they're going to help you and they don't help you. I mean, what's in their hand, right? I mean, what are they holding here? What are they holding in their hand, right? They'll tell you one thing and they do something else. I mean, just like Joe Biden, Tim and Joe. They're like, oh, I'm going to help you. I'm going to help you. Here's my hand. And then they're like, oh, you voted for me? I'm the president now. I'm Tim and Joe. Oh, I'm just going to take my hand back. I'm just going to give you my elbow. Here, elbow bump, elbow bump. You know what I mean? It's like, hey, I'm going to reach out to you. Just vote for me. I'm going to help you and your children, with student loans. I'm going to help you with minimum wage. And then you vote for Joe Biden. Joe Biden's like, oh, I'm going to take my hand back now. I'm going to take my hand back. Oh, I'm going to close my hand. Oh, just elbow bump, elbow bump, elbow bump. That's Tin Man Joe. You know what I'm saying? I mean, geez, I mean, let's get real here. You got duped by Tin Man Joe. Tin Man Joe pulled a fast one on you. And that's really sad that what happened. But I mean, just proof is in the pudding. Where's his glove, man? Where's his glove? Where's Tin Man Joe's glove? You know what I'm saying? Um, let's be honest here. Um, as you see behind me, I presented a research poster at the Clinical Nurse Leader Annual Summit. So, as you know, I'm a nationally certified clinical nurse leader. And all of us nationally certified clinical nurse leaders, we have an annual summit. And we just had one in February 25th through February 27th, 2021. I submitted a proposal to present my research on COVID-19 in November 2020, and it was accepted. And so I was invited to present my poster research, so that's what I did. And so I share with fellow clinical nurse leaders, CNLs, my research on COVID-19 and my recommendations on how we can reduce COVID-19 death among nurses and in the hospital units. So, I'm trying to do my part to reduce COVID-19 death in the hospitals and to protect frontline workers, nurses, and also, there are others working in the hospital, right? There's the patient care technicians or certified nursing assistants. There's the respiratory therapists. There are the pharmacists. There's the dietary people who deliver food. There are cleaners, people who do janitorial type work, cleaning rooms, patient rooms. So they have exposure to patients, right? And you have physical therapists, occupational therapists, you have physician's assistants, you have nurse practitioners, you have MD doctors, you have DO doctors, you have podiatrists, you have all kinds of specialists, kidney specialists, dialysis, and there are people who take X-rays or MRI or CAT scans. There are all these healthcare workers, and I'm doing my part to protect them through my evidence-based research. So I study the evidence of what happened in hospitals and what in terms of COVID-19 spread, and I reach out with my research to protect their life. I research what happened and how to improve hospitals, how to reduce COVID-19 infection. So I'm an expert by definition, right? I was invited by American Association of Colleges of Nursing, which sponsored CNL Summit 2021. And American Association of Colleges of Nursing is the #1 accreditation agency for all the nursing schools in America. So associate's degree nursing program at NOVA, Northern Virginia Community Colleges, associate degree in nursing at Germania Community College, bachelor's of science in nursing degree at George Mason University or in Fairfax County or Marymount University in Arlington County, Masters of Science in Nursing programs at, University of Virginia or Virginia Commonwealth University. These are all accredited through like a nursing accreditation agency. And American Association of Colleges of Nursing is the #1 primary one. So they recognize the importance of my research, right? And so that's why my proposal was accepted and I presented my poster presentation, and you see that behind me. But so I reach out with my hand to help you, to hold your hand and bring you over, especially if you're nurses or healthcare workers who are facing potential COVID-19 infection and death. And every hospital right now has dozens or even hundreds of nurses or healthcare workers out with COVID-19. I mean, all over America. And that affects survival rates of patients, because if you have numbers decrease among nurses or other healthcare workers who can treat and help COVID patients or even non-COVID patients, then death rate's going to go up, right? So my research is directly relevant and important to saving lives. And you can see a poster that I posted to my Twitter account, Heerak for Congress, Twitter, today on March 2nd. So you go, March 2nd, you look through the tweets, you can see the poster and you could click on it and look at the details of the poster. And you can get some help from that. Even if you're not a nurse or respiratory therapist or physical therapist, occupational therapist or CNA or medical doctor or DO or podiatrist or kidney specialist, I mean, you can learn something that will help you. And obviously, this is evidence-based research based on what actually happens in hospitals and in healthcare areas with COVID-19. So obviously, it's definitely going to help you. So I'd encourage you to see it. COVID-19, on April 2nd, there were only 5,911 cases in the United States, as you can see from the board there. And April 2nd, we had so 5,911 COVID-19 deaths, but 244,678 COVID-19 cases. But look at May 2nd, the death rate went up to 66,364 in 1 month. And actually, probably April was the deadliest month in 2000. Well, it wasn't the deadliest month, but it was relative to how many people and how many states had COVID-19 infection. We can probably argue that it was highly deadly, because, most of the infections were in New York, right? And so the death rate, it's not like all 50 states had COVID infections spreading everywhere, right? So when you look at it from that perspective, month of April was highly deadly. Right now it's March 2nd. We're not April 2nd yet. We're 1 month away from April 2nd. So this 2021 April can be far more deadly than 2020 April, right? Looking at the comparison, I mean, let's compare what happened in 2020. Remember, we had COVID-19 infections in the state of Washington. Not as many died there. For some reason, you would think that more people would die in like wintertime, right? That's what you would think. Because during flu season, that's generally how it is. During winter, more people die from the flu. But strangely, not that many people died in Washington State. It's not like New York did much better than Washington State, like Seattle or whatever. But not as many died when COVID-19 hit Washington State earlier, right? But in New York, around springtime, we had a lot of people die in April, around April. And that was the case not just in New York, but also in New Jersey. And that was the case in Detroit, right? And Illinois, Chicago area. So looking at the evidence-based research, when we say evidence-based research, we're talking about research based on what's actually on the ground. You see what I'm saying? What actually happens on the ground. So theoretical research may say, well, more people should die in winter. That's theory, right? But actual reality is different. Like, you remember when Dr. Fauci said nobody's going to die in the summer? Or in summer, COVID-19 is going to go away and then it's going to come back during the flu season. Do you remember him saying that around April? And I disagree with Dr. Fauci in April 2020 and said, no, COVID-19 is a 365 days a year virus. It's going to keep killing In the summer, do you remember that? I disagree with Dr. Fauci and I was right. Dr. Fauci was wrong. Do you remember that? April 2020. Just go back and see my show. See my show from April. Because I talked about it. I disagree with Dr. Fauci. I disagree with Dr. Gupta. I disagree with a lot of the healthcare experts at that time, and I was right and they were wrong. And the fact is, they're operating from a theory, right? They know that there are certain patterns that flu viruses and core viruses follow. And they're assuming that COVID-19 acts like a flu virus or core virus. So using their spectacle, so they're using their glasses as experts who understand patterns of flu and core viruses, and they assume that COVID-19 acts like that. So they assume. So they have blind spots, meaning they assume that COVID-19 acts like a flu. They assume that COVID-19 acts like a cold virus. So they develop a whole theory of how, or prediction of how that's going to be, right? And that's a theoretical research, not necessarily evidence-based research. Evidence-based research is different. It questions the theory and say, what's actually happening on the ground? We understand there's a theory. We understand there are patterns from the past, patterns of this type of virus, how it normally acts, but what is it happening on the ground? What is actually happening? And that's what we call evidence-based research. And as clinical nurse leader, what we care most about is evidence-based research, because clinical nurse leaders were trained to actually improve the hospital functioning, patient surviving death in the hospital unit. That's our primary goal, right? To actually help the patient survive. So yes, we care about the theory. Yes, we care about the patterns in the textbook, but what we most care about is what's actually happening in the ground. And so Dr. Fauci and pure theoretical scientists and infectious disease experts, they can run into serious problems when we have new viruses, because they're operating from their box, right? They have their way of looking at the world, looking at viruses that they're trained in. So when there's a virus, new virus, like novel coronavirus, new virus that emerges, they assume that they're gonna function similarly to other viruses in the category. But in fact, that virus is quite different from the other viruses that they think are related to it. You see what I'm saying? So this kind of prejudice or bias, I would call this implicit bias, because they're functioning from this implicit bias that coronavirus should function like SARS virus, for example. This implicit bias not only limits them in the way they understand the new virus, like novel coronavirus, but it skews their predictions. And what ends up happening is that results in serious consequences, right? When you have a healthcare problem at the community level or public health level, and you make wrong predictions, it can kill a lot of people. So do you remember Dr. Fauci saying, don't wear a mask? Do you remember Dr. Gupta in CNN saying, don't wear a mask? Like in March and April? That recommendation alone killed thousands. People who would have worn masks if Dr. Fauci told them to wear a mask, but because Dr. Fauci told them not to wear a mask, they didn't wear a mask. There are thousands who died because of that. Obviously, Dr. Fauci wasn't trying to get people killed. It's not like he's an evil guy who's trying to get people killed, but he was operating from a certain way of looking at the world based on theoretical research that he has. And he didn't really look at the realities in the ground. And by the time he looked at the realities in the ground, he realized that his recommendation to people, Dr. Fauci's recommendation to people, Dr. Gupta's recommendation to people, World Health Organization recommendation to people not to wear a mask is what actually got them killed. It was too late because they were already dead, right? But they looked at the fact that all these people died not wearing a mask, and then they started to flip their recommendation and say, you must wear a mask. You see what happens? because they're more dependent on theory. They're not dependent on reality on the ground as much as theory. In that sense, clinical nurse leaders, we're stronger and more helpful because we actually look at the reality of the ground. We take a step back and we don't ignore the theory and the patterns in the textbook, but we look and focus on what's actually happening in the ground. You know, yes, the theory says X, Y, and Z. Yes, the textbook says X, Y, and Z, but what's actually happening in the hospitals? What's actually happening in the rooms? What's actually happening with the nurses, with the respiratory therapists, the physical therapists, occupational therapists? And what's actually happening? Let's use that as the primary source of information to save lives. Do you see what I'm saying? So this is where specialists, theoretical infectious disease experts like Dr. Fauci, and experts at World Health Organization, experts at Center for Disease Control can run into problem because they're kind of coming from a textbook understanding of everything. And that's why Center for Disease Control has recommended not to wear a mask because they're using their theory, and their recommendation has killed thousands of Americans. Let's be honest here, you know. And Center for Disease Control recommending that you should open schools is the same kind of thing. It's going to end up killing thousands of children. Just watch. Just watch. I mean, I will have these, it's not Daily Show anymore, but I'll have like, episodes from time to time when there are big changes. And I will point out to you what I said and how I was right. As you know, I'm like the Leonardo da Vinci of 21st century. And I'm almost always right, And so if you heed my recommendation, you're probably going to survive. But if you don't heed my recommendation, you probably are, you're going to struggle. That goes, I believe that I'm more right than Center for Disease Control in regards to COVID-19. And I have been. Let's be honest here, just watch my show. When Center for Disease Control said don't wear a mask, I said wear a mask. And I was right and they were wrong. Obviously, Center for Disease Control came to my position and started saying you should wear a mask. Thankfully, because the original recommendation not to wear a mask is what got thousands of Americans killed, what resulted in uncontrolled spread of COVID all over America. The original recommendation of Center for Disease Control. So I would recommend you watch my show as more correct than Center for Disease Control when it comes to COVID-19, because I have a history of being more correct than Center for Disease Control. So the chances are I'm going to be more correct than Center for Disease Control going forward as well, because that's what it has been in the last 11 months. I've been more right than Center for Disease Control when I predict that summer will kill many Americans. That's exactly what happened when Center for Disease Control said summer will not kill many Americans. That COVID-19 is going to go away and come back again in winter, right? So I believe that my predictions are going to be more accurate than Center for Disease Control predictions going forward from today as well. So let's look at the patterns here. Washington State did not have that many COVID-19 deaths compared to New York and New Jersey in April. And Washington State had cases earlier, right? Weeks, months earlier, and in wintertime. So if COVID-19 acts in a similar pattern as it did in 2020, you should be assured, you should be certain that we're going to have far more death in the spring than in the winter, if it works in the same way. Obviously, time will tell if COVID-19 in 2021 will act in the same way as COVID-19 in 2020. COVID-19 has mutated. We have several variables now. We have a vaccine that's introduced, several treatments that are introduced, antibody treatment. So COVID-19 is mutating to overcome them. So there are some irregularities that may be created because of this, because COVID-19 is mutating to overcome everything that's thrown at it, right? But if COVID-19 acts similarly in 2021 as it did in 2020, then you should be certain that we're going to have far more COVID-19 death in April than in January, for example. Um, let's see, time will tell. I mean, right now, cases are kind of plateauing, but that doesn't mean much because we've been locked up. Schools have been closed. Many schools have been closed, right? So now schools are opening up, right? Like some states are opening their movie theaters. Things are opening, and this is 1st of March. Look at April 2nd, we only have 5,911 deaths. May 2nd, we have 66,364 deaths. So we're opening up now. States are opening up now in March 1st. So by April 2nd, the whole month of April, we may have crescendo of death that could be like hundreds of thousands of deaths in 1 month. That's possible. Obviously, I hope that won't happen because I don't want Americans to die. I've created this show to save lives, but there's a high likelihood, I would say, that that will happen. Let's look at it from February 2nd to March 2nd. Deaths are numerous. We're having thousands of deaths every day. Look at United States of America. From 2nd of February to 2nd of March, we have what? Over 70,000 deaths, right? Over 60,000 deaths. 446,731 death on February 2nd. Now, today, March 2nd, we have 514,660 deaths, right? Averaging more than 2,000 deaths per day. Cases are going up quite high too. Globally, we also see death and infections are continuing aggressively. World COVID-19 death on 2nd of February was 2,251,491. On March 2nd, now it's 2,540,340. Right, so that's a lot of death, right? That's 250,000 dying, or 200,000 dying in 1 month. And now the problem is a lot of other countries are opening up too. For example, England is opening up, paralleling the opening up of America, because they're thinking like, oh, now the cases are going down, deaths are going down a little bit. So why don't we open? And you know what's going to happen, obviously. I mean, we've been through this before. I mean, we've gone through this cycle many times. I mean, we had first peak, second peak, third peak. Now, we're about to face our fourth peak. And we don't know how many people are going to die in fourth peak, but fourth peak is coming in April. It's going to start in March, but it's going to come in April. And we can have hundreds of thousands of people die just in the United States alone in April. Because remember, April 2020, we only had infections in New York and New Jersey, a few places. And so nurses and healthcare workers from other states flew in to help New Yorkers. Do you remember that? Now, COVID-19 infection is in all 50 states. So if I am correct in my hypothesis that more people will die in spring than winter, and in the sense that COVID-19 is debunking the trend of core viruses and flu viruses, if I'm accurate in my theory, hypothesis, then we're going to have like hundreds of thousands die in America in April. With all the states opening up, it may even hit far more than that. That's a possibility. So let's see what's going on April 2nd, because that's the, that's a 12-month anniversary. 1 year anniversary is April 2nd, that's coming. But because schools are opening up, I think you agree with me that you can expect far more to die in the coming weeks, right? I mean, it's not like people are not dying. Like 2,000 or more are dying every day. But that's going to just spike up again in April. Do you remember last year, Easter time, how many people died? Yeah, Easter's coming. So that's one way to kind of compare, right? Easter 2020 to Easter 2021. How many people will die? You can go back and see my show from the Easter time, like last Easter 2020. It's a daily show, so you can see show of every day of the Holy Week. I, you know, and you can see what happened that time, right? So just go to YouTube channel Heerak Christian Kim for U.S. Congress YouTube. You type that in Google, and then you can see the different episodes from Holy Week 2020, and you can see what was happening last year, and then you can kind of understand what you can expect to happen this year. But now it's going to be at like 50 states level. It's not just like few states. It's like all 50 states. You know, um, yeah, it's going to be horrific. Hundreds of thousands can die, or far more than that can die in April, because states are opening. By the time they realize that they made a mistake in opening it, it's too late. Genie's out of the bottle. Yeah. So we're looking at horrific month of April right now. Um, I chose 3 articles that I thought can help you. And so the 3 articles I chose are kind of related to like three important issues that you may have to worry about. I figure, there are a lot of things happening, but 3 most important issues I would argue are these, represented by 3 different articles. First article, um, all our recent progress with COVID-19 could be wiped out by variants, Center for Disease Control director says. Uh, this article is by Holly Yan and Christina Maxouris in CNN. And the article states the U.S. is at risk of losing all its recent gains in the battle against COVID-19, all recent gains. As highly contagious variants take advantage of Americans getting lax with safety measures. As you know, the COVID mutants are more contagious than regular COVID, right? And as I explained, all the COVID-19 vaccines are not 100% foolproof. So even if you get COVID-19 vaccine, you can still be infected. They're like 85% effective, whatever, they're saying. None of them are 100% effective. It's like using a condom that's like 85% effective. There's 15% chance that women can get pregnant. And as you know, no condom is 100% foolproof. Women do get pregnant even when men use condom, that does happen. Yeah, but obviously, condom is probably more effective than these vaccines. So you can imagine the danger you're in terms of COVID-19 infection, even if you're vaccinated. And I'm sure all the health experts agree with me on that point, because they know that it's not 100% effective. No healthcare expert will say vaccines are 100% effective. That's anti-science to say. Quote, this is from the director of Center for Disease Control, quote, please hear me clearly. At this level of cases with variants spreading, we stand to completely lose the hard-earned ground we have gained, said Dr. Rochelle Walensky, director of the U.S. Centers for Disease Control and Prevention. We're going to lose everything. And we have 2,000 people dying now. What does it mean to lose everything? 10,000 deaths per day, 20,000 deaths per day. Yeah, we're looking at some serious problems right now. After weeks of tumbling cases, new infections are on the rise again. It's already on the rise. It's not like we're going to have rise like a few weeks later. It's already on the rise. And the states are trying to open up, right? Because they're impatient. They're impatient, so they want to open because they think it's like declining. But it's not really declining. It's on the rise again. About 2% more this week compared to the previous week. And do you see what's going on? Virginia, Governor Northam loosened several restrictions on March 1st, right? It's the same exact thing, right? And Virginia has been having over 100 people die every day for past 8 days from COVID-19. And Director of Disease Control Walensky also says, similarly, the most recent 7-day average of death has also increased more than 2% to nearly 2,000 deaths per day. Yes, I mean, you're going to open different states when you have 2,000 deaths per day. What do you think is going to happen? You think that deaths are going to go down? Is that what you think? This is common sense. It's, you know. Second article. Virus variants in Brazil infected many who had already recovered from COVID-19. So this is the case of a Brazilian COVID mutant. And this article is by Carl Zimmer, New York Times, also today, March 2nd, 2021. Scientists have also had their eye on a third concerning variant that arose in Brazil called P1. So first COVID mutant that we were made aware of was COVID mutant from United Kingdom. Second COVID mutant is COVID mutant from South Africa. Now the third COVID mutant is the COVID mutant from Brazil, right? So this third COVID mutant is what this article is about. Now 3 studies offer a sobering history of P1's meteoric rise in the Amazonian city of Manaus. It fueled a record-breaking spike of coronavirus cases. It came to dominate the city partly because of an increased contagiousness, the research found. But it also gained the ability to infect some people who had immunity from previous bouts of COVID-19. It's a different strain infecting people who already had COVID-19, maybe the original strain, who had fully recovered from that. And laboratory experiments suggest that P1 could weaken the protective effect of a Chinese vaccine in Brazil. So it's saying, you know, it will overcome vaccines infection, even if you had COVID-19 before. So President Trump had COVID-19 before, and he completely recovered. But if Brazilian COVID mutant hits him, he could get infected with COVID-19 again. That's what it means. And it can happen to everybody. So every nurse who were infected with COVID-19 before, who survived, can get infected again with Brazilian COVID mutant and other COVID mutants which may come into existence in the coming weeks. All over the world, and even in America, homegrown COVID mutants, like from New York and Ohio. Yeah, so just because you had COVID-19 a few months ago and you fully recovered, you're not safe. You get COVID-19 again from a COVID mutant like from Brazil, you die from it. That's a very important point to remember. What does this mean? This means you cannot have herd immunity. That's impossible. Think about it. By definition, herd immunity is achieved when enough people have immunity, right? But if COVID-19 strain from Brazil can infect the same people who have caught immunity again, by definition, there is no immunity. You see what I'm saying? Herd immunity means if enough people have immunity, the virus will go away. That's the idea, right? That obviously proves that COVID-19 will not go away. Herd immunity is an impossibility because COVID mutant can infect people who already have immunity, who already have vaccination, right? What that means is herd immunity is absolute impossibility when it comes to COVID. That's what it means. At least at the current stage, that's what it means. So we cannot achieve herd immunity even if 100% of US citizens are vaccinated. That's impossible. Because COVID mutants can infect people who have vaccination and immunity having had COVID-19 before. Right? By definition, herd immunity is impossible. The same people can get COVID-19 from different strains again and again. And mutations are happening every week somewhere, right? See, if you get COVID-19 Brazilian strain and you recover, there'll be another mutation a few months from now which can infect you again. You see what I'm saying? So herd immunity is impossible with this COVID-19. That's the current status now. Easter's coming, and one of the great nice things to do is, paint the eggs. Do you do that at church? Well, I remember, being in Sunday school and painting Easter eggs at church. That's one of the things that I really enjoy doing. Painting Easter eggs. And you know, you may not be able to go to church, because maybe you have COVID-19 or whatever. So one of the things that you can do at home, and obviously, if you're a Christian parent, you got to start planning for these things. I know some of you are kind of in depression and anxiety, and uh, maybe some of you are going to different stages of grief, anger, denial. It seems like a lot of people are in denial that COVID-19 is infecting people. They're like, let's open schools, let's open schools, Kids need to learn. These are people who are in denial that COVID-19 is actually killing 2,000 people per day. It's in fact highly infectious. I mean, it's a stage in grief, right? Some people stay in denial for a long time. They're like, oh, COVID-19 doesn't really exist. Don't wear a mask. Just open everything. Open all the restaurants, open all the movie theaters, open all the schools. COVID-19 doesn't really exist. They're stuck at the grief denial stage of their anger, the grieving process, right? Um, they're stuck in denial. These people who want to open everything up. It's sad because they can get COVID and die. I mean, they're in the stage of denial, which is one of the stages of a grieving process, right? They're grieving that their normal life is gone because of COVID. And instead of dealing with it in a healthy manner by wearing a mask and social distancing and trying to work at home, and try to reduce the spread of COVID, they are taking the road of denial, right? They're like, oh, it doesn't exist. Oh, I'm not going to get infected. Oh, we can open schools and it's going to be okay. They're in the stage of denial. And so it's a part of grieving process and it's unhealthy. And some of you may not be in the denial stage, but maybe some of you are kind of in the anger stage, or you may have depression or whatever, and you may not do what you should be doing as a mother or father, right? You should be planning for your children's education at home. You should allot different times during the day to ensure that they're learning their math, English, history. If your school hasn't given you textbooks or electronic ebooks, you should order books from Amazon that relate to their subject matter, or watch YouTube videos with them on different subjects, that relate to their grade level. You could always email your teachers for advice on, ask them for a syllabus, schedule what your children are supposed to be learning, and get involved with your children's learning process, right? That's what you as a mother or father should be doing. You should be strong, and you should ensure that your children are learning while they're at home and remotely learning. You should support them in this process, right? That's what you should be doing. But there are some parents who are lazy and they're like, oh, just open up schools. They think like schools will solve everything. Like they don't want to be good parents. They don't want to do their role as parents. So they want schools to open so the schools will take care of their children's education. These are like what I call lazy parents who want schools to open because they think like schools opening will solve all of their problems. Like parents who say schools should open so children can learn, they're bad parents by definition. I would argue. I mean, it's my opinion, obviously, but I would argue any parent who says schools have to open for my children to learn, obviously are parents who are not actively involved in their children's education process, right? Right, because they have crutches. They're dependent on schools opening. Their children cannot learn if those schools don't open and their children are not physically there. It sounds to me like the parents are trying to get rid of their children from home because they're too lazy to take care of them, too lazy to raise them. That's what it sounds like to me. There's probably just bad parents. Whenever I hear parents saying like school should open so their children can get education, my go-to is like they're probably bad parents. I mean, I can be wrong, and I will put to that. But a working kind of assessment would be like they're probably like not very involved in their children's lives. They're probably not very involved in their children's education. They don't want bother. They want their children like gone from home for like 8 hours. That's the kind of parent they probably are. Why would they say open school so children can learn? For most of human civilization, children learned at home. They didn't go to like a building to learn for most of human civilization. And for most of human civilization, parents were primarily responsible for their children's education. It's only in recent times in human history that we have these formal education like public schools that children go to learn. That's like recent. It's not. That's like less than 1% of world's history, where when children learned in a building called school. You see what I'm saying? So to assume that that is the only way to do it, it's very ignorant. I would say ignorant of human experience, human history, Western civilization even. For most of Western civilization, students do not go to a building to learn. For most of the 2,000 years of just Western civilization history. So yeah, so it's a serious problem. Like there are so many ignorant people, who are like opening schools is like the solution. That they're ignoramuses. Because they don't understand what Western civilization is. They don't understand the history of education. They don't understand what it means to be a parent, really, and to be responsible for their children's education. Parents are supposed to be the primary individuals responsible for their children's well-being and education. Teachers are secondary. Yes, children go to school to learn, but studies after studies show that students who are successful in schools have parents who put in the time to take them to the library and have them read their book and discuss the book that they read, or you know, it's not like schools will solve the problem. You know, parents who like put 100% of the responsibility in schools generally probably will have children who don't succeed. Um, it's just education-wise, involved parents make the difference. When I was teaching at Savoy Elementary School in Ward 8, Washington, D.C., I try my best to get parents involved, visited the parents at their home, talk to them regularly as much as I can. Because parental involvement is important for success of children uh, learning process. It's not like you put children in school, they automatically learn. It doesn't work that way. Yeah, so we need to rethink education, because we have COVID-19, it's killing people. And your children, by going to school, will have higher risk of dying from COVID. And your children have high risk of getting COVID and giving it to you, and you have high risk of dying if your children go to school. So, it's in your self-interest not to send your children to school and raise your risk for COVID-19 death. I mean, 2,000 people are dying every day now. You're trying to open up schools. I'm just trying to save your life, save lives of your children. So going back to Easter egg, Easter's coming. Get some Easter eggs, boil them. You can buy these Easter egg paint in a local grocery store or CVS pharmacy or Giant food store or Walmart. You can paint the eggs with your children. Get involved with their lives. Take like videos and photos. Talk to them about Easter. Maybe read the Bible together. There are like videos in YouTube for children on Easter. Take responsibility of your children's education. All education is basically reading, right? 1 year of English class is basically can be summed up in reading and writing. You can do that at home. And some parents, they homeschool their children, and studies show homeschool children are far more advanced in knowledge than students who actually learn in a school building. Yeah, I mean, there are like about 3 million Americans who homeschool, 3 million American children who are homeschooled. On average, they do far better on everything. So parents getting involved, that's an important thing. And when your life is concerned and your children's life is concerned, maybe this is time to just say, hey, I'm going to just do remote learning with support from the school system. I'm gonna take this time to be a better parent. I'm gonna try to work from home. Set up your home office at home. You gotta adapt to COVID-19 because it's not gonna go away. You know, we've seen the pattern since last year. You know, you start opening up, it's gonna spike up. You close things down, it's gonna start going down. And you open up, it's gonna go up. You know, this is a pattern that's existed. So why don't you think that's gonna happen again? Yeah. So with Easter, you can get Easter eggs, and you see your child will be a happy child uh, with uh, with you investing in their time. So what I would say, you know, this is, let's say this is your happy child, invest in their future, you know, and this is like, you know, St. Patrick's Day is coming. So, so you have you know, 4 leaf, you know, clover, you know, invest in your child. You know, it brings you luck. You know, invest in your child's education. Every day you spend time with your child, reading together, discussing what your child has read. You're investing in your child's future, you know, and that's priceless, right? It's good luck that you're bringing to your children, and then your children will be very, very happy. You know, and look at all this wealth that they have acquired because of the time that you've spent. You know, and what you could do is every day you spend with your child, you could kind of illustrate to them. You could say, look, I'm investing in your future by reading together with you. You know, visually help your child, especially if your child is an elementary student, first, second, third, fourth, fifth grade. Help them understand what you're doing, you know, in ways that they can understand. You know, you can invest in one of these things, you know, you could have a piggy bank where you put like pennies in, for example, get like a lot of pennies from the bank. Visually illustrate what you're doing. I'm investing in your future, a penny for your thoughts, you know, and just kind of spend some time being creative with your children. You know, do you remember if you're a husband, you're a guy, when you saw your wife and you saw how beautiful she was, you know, the time that you spend trying to be creative to get her to go out with you or to get her to marry you, you need to invest that kind of time with your children, you know, and same goes with the wife, you know. You know, when you saw the guy that you loved or you liked and you wanted to marry, you probably spent a lot of time plotting and planning to get to win over his heart. You know, and you succeeded obviously because you married a guy that you love. You know, clever women are successful in getting the guy they love, right? That's what separates clever, superior women from women who are not. You know what I'm saying? Um, you know, getting what you want, right? I mean, the most important thing is getting the guy that you want, right? So, yeah, and you know, obviously you deserve a winner necklace for getting the guy that you want. Uh, uh, the head is, you know, you could like, you know, put in where's the, yeah, yeah, winner hat, winner. Yeah. So yeah, so yeah, so you know, you can celebrate being a winner with I don't know, it's not really a necklace, it's like head necklace. My head's like really big because it contains a lot of information. I guess God created my head really big so I could put a lot of information in there. It's kind of like, you know, with your children, you know, investing in their future, you know. God gave me a big head so I could put a lot of information in there. But anyway, yeah, but you know, it's not always easy because not all the hats fit. You gotta get a like right size hat. And I, you know, I custom made this hat, you know, for my election, so it fits my head. But not all the hats fit because I have a big head. But anyway, yeah, you know, yes, invest in like a trophy. So this necklace is not going down. Well, it's free for kids, you know. I have these like little winter necklaces, you know, for my fifth graders. You know, when they achieve, I give them like a little prize or whatever. It fits in their head, but my head's a little bit big for the. But anyway, yeah. So you do need to invest in your children, you know, education, and you know, you gotta think about this as a permanent condition. You know, we're never gonna go back to 2019. We're never gonna go back to what you had before COVID. That's the mentality you should have. I mean, surprise, surprise, COVID disappears. Then, hey, you know, you just go back to where it was, but don't count on it. That's what I'm saying. You're trying to create a reality that doesn't exist. You know what I'm saying? It's not healthy for you mentally to try to go back to the way it was before COVID. It's mentally not healthy because you're not living in the real world, right? The real world is we have COVID-19. The real world is that like 2,000 people are dying every day, even when cases are low in the United States of America alone. And that's the reality. If you open up, you're going to get infected and die. That's the reality. I mean, geez, you got to deal with the reality because ignoring the reality is not going to help you survive COVID. It's not going to help your children survive COVID, right? So yes, you may want to go back to where things were, but you can never go back. You cannot go back right now, you know? I mean, miracles do happen, but they rarely happen. So you gotta, you gotta understand that it's probably not gonna happen. Third article that's important for you for today, and it's a new development in Israel that raises many flags, but it's coming to America, and you can safely assume because the world is connected, and there are a lot of people from America who go to Israel and come back. So this is coming. Whatever this thing is, it's coming. Maybe we can call it the Israeli virus. COVID-19, for the second time in Israel, stillborn baby has corona. So baby is being born, stillborn. And when they do an autopsy on the baby, they have coronavirus. They're infected with corona. So this is a serious problem. It's a new development. It's brand spanking new development in Israel. And it's probably going to spread throughout the world, including the United States. So if you're a pregnant mother, maybe it's a good idea to not take the risk. I mean, if you're willing to take the risk, take the risk. I mean, it's your life, it's your child, it's your baby. But if you're like pregnant and you don't want to take the risk of losing your baby, um, especially if you're a nurse or a physical therapist or occupational therapist or respiratory therapist or MD or physician's assistant or nurse practitioner who is pregnant, right? You're pregnant and you don't want to take the risk of losing your child, then you probably should take off from work and maybe do telehealth or whatever. Because before, we don't really have cases of baby who are pregnant mother dying from COVID, like inside the womb, right? We don't really have that. But now we do, and we have this in Israel. So what this means is whatever this thing is, whatever this mutation is, it's coming to America, and it's going to start happening in America. That's what it means. And obviously, it's going to take scientists maybe months to identify, maybe longer than months, depending on how fast it spreads. And obviously, Center for Disease Control has to monitor this, like babies being born stillborn. You actually have to do the autopsy to see that baby has COVID, right? If hospitals are not doing autopsy in labor and delivery units, when baby is stillborn, they don't know that the baby died from COVID, right? Right? So it can escape scientific research because you have to actually do an autopsy of the baby to understand why it died. You have to do a COVID-19 test. I mean, you cannot do a nose swab on a baby, right? So you got to do a more invasive, test to see that baby died from COVID. So if you're not looking for it, you're not going to find it, especially with babies who die, in mother's womb, right? So Center for Disease Control and American Academy of Pediatrics, they have to start taking this seriously. What happened in Israel probably can't happen in America, and they have to order autopsies. I don't know what's going on with Center for Disease Control. This is so new. I don't know what policies they're setting forth. I don't even know if Center for Disease Control discussed this, if American Academy of Pediatrics discussed this. But it's a problem because COVID-19 is mutating. To assume that children are not going to get COVID and die, like Joe Biden in his first town hall, he sounded so ignorant. Do you know what I'm saying? He's like, oh, you're not going to get COVID. He's trying to assure like an elementary school kid, was it, or an eighth grader, or what was it? She's safe from COVID. And Joe Biden acts like COVID-19 doesn't mutate. It's not going to infect and kill children. Like you remember that in the first town hall. And that's like, it's like trying to convince an eighth grader that Santa Claus still exists, I mean, it's dishonest. You know, there's a reason why I don't like Joe Biden. I think he's being dishonest. I think he's unnecessarily risking lives of children and then lying to them about it. I mean, it's a lie because science shows that children can get infected with COVID, children can die from COVID. So when Joe Biden actually says on TV, in a town hall, that a child should not worry about getting infected with COVID, he's actually lying to the child. I mean, that's what it is, right? Because science shows that children can get infected and die from COVID. That's like science. We have data. And I just thought that was just very dishonest. You know, just because Tin Man Joe wants to open up schools, he's going to lie to a child national TV. That just, what separates Joe Biden from Donald Trump, really? Right? Both of them are trying to argue that COVID-19 is not going to kill children, right? They're both trying to open up schools. How are they different, really? You tell me, how are they different? You know, let's talk truth here. How is Joe Biden and Donald Trump different when it comes to the lies about children being safe in a school? How are they different? No, children are not safe in school. This is a killer virus. It's constantly mutating. It's killing children. It has. And now it seems to be mutating to kill babies inside mother's womb. So let's read this article. Israel, Israel, Israel had, COVID-19 for the second time in Israel. Stillborn baby has coronavirus. Obviously, they're doing autopsies, right? To find out. Mayan Yafe Hoffman is the author, and it's in the Jerusalem Post. And Israel is, advanced in science. It's not like they're doing hocus pocus here. We're talking about, yeah, I mean, you gotta take that call. Did my child die from COVID-19 or not? Did my baby die from COVID-19? Hey, you gotta make that call to autopsy. Autopsy, did my child die from COVID? Your child dies in mother's womb. I mean, why? Why did this happen? Let's see. A woman in her 36th week of pregnancy. How many children die in 36 weeks? A healthy infant inside a mother's womb in 36 weeks. How many of them just die? I mean, if you're a labor and delivery nurse, tell me, how many patients have you known where a healthy infant baby inside a mother's womb at 36 weeks, that's basically due time, right? Just dies. How many times have you seen that or heard about that? You see what I'm saying? So this is a serious stuff. A woman in her 36th week of pregnancy gave birth to a dead baby on Friday in Bear Hospital in Kfar Saba. I had like a lot of friends at Kfar Saba. I love this, right? I lived in Israel for 3 years. I had like, basically all of my closest friends were Jewish, it's a Jewish thing. So my best friend, was Jewish, Serge Gorman. He married he's an immigrant from France. He was in the Ma'of program, and he married an immigrant from North Africa, who was, I think she's French speaking as well, because like Morocco, Algeria, they speak French. So they're like colonies of France, right? And so a lot of Jews immigrate from Morocco and Algeria. And Serge Gorman, I think his mother's side, maybe even his father's side. His mother's side is originally from Morocco, like he's a Moroccan Jew. Father's side is an Algerian Jew, I think. But he's French, and they're like French aristocrats. French people, they have this like darker skin and darker hair. Like that's stereotypical. Obviously, there's exceptions to the rule. But when you think about French guys, you think of like black hair, like a darker skin kind of guy, right? And girls seem to like the dark and handsome, so French guys are like kind of popular. But so Serge Gorman, he's a French, citizen. It's like a French Jewish aristocrat. But originally, like, I guess hundreds of years ago or whatever, or a few generations ago, his mother's side and father's side immigrated from Morocco and Algeria to France. But I think that's like that with a lot of French Jews, at least the ones that I met in Israel. And we go to Bat Yam during weekends because his parents have like a summer home, and he and I, we did, we're kind of like the dudes in Israel. He and I, we We crash a neighbor's home for Shabbat dinner. Shalom Shabbat, and we eat their food. Two single guys, and then we generally hit like Tel Aviv nightclub, and we dance with the night with beautiful women. you know, so Serge and I were like the two dudes in Israel. But anyway, when he's a married guy. I'm not married yet. Hopefully God will send me like someone who looks like, Paris Hilton when she was younger. She's really pretty, Paris Hilton. Especially when she was younger. As you know, like women are most fertile, like 18 to 24 or 26. They start losing their fertility like around 30, right? Or 28 or 30. And their body starts sagging. So I'm hoping, God will send me some beautiful woman who looks like Paris Hilton when she was like 22 or 20, But anyway, we'll see. Hopefully God loves me enough to send me what I want and what I'm praying for. But I don't know. I don't know if God will answer my prayer. I'm like, dear Lord Jesus, you know how much work I do for you. Please send me somebody who looks like Paris Hilton when she was 20, 22. Like beautiful, looking like a Norwegian princess, like she was when she was 22. Who's a good Christian, who's like holy like Virgin Mary. But anyway, who goes to mass every day, who loves Jesus. I don't know. Let's see if God answers my prayer, but I hope He will. But God doesn't always answer your prayer. God does what He wants. So, but anyway, one can pray, but can't one? But anyway, going back to the article, a woman in her 36 weeks of pregnancy, and maybe some of you are 36 weeks pregnant, maybe you're 30 weeks pregnant, but we're talking about a baby who's basically almost to full term, or actually to full term, just dying in the womb. Yeah, because of COVID. She had gone to the hospital after she stopped feeling fetal movements. This is at 36 weeks, right? She was like, stop feeling the baby move inside her womb. Laboratory tests performed after baby's birth showed that she was infected with coronavirus, apparently from the mother. So the question is, if the mother gets infected, does coronavirus infect the baby through the umbilical, what is that? Umbilical cord, like does it cross the placenta? How does it infect the baby? Because obviously baby's inside a womb in amniotic sac with fluid filled there. So it's not like baby's being infected through air, right? It's not like a respiratory infection where mother is speaking to a baby and then baby who's like outside the womb breathes in what the mother says and get infected and dies. We have cases like that too, but this is different because the baby's inside the mother's womb before the water breaks. So the baby is inside the amniotic sac, which is the protective sac, right? And there's a fluid in there, and baby's inside the fluid. So the question is, how did the baby get infected? If it's not through respiratory transmission, right? So this is a new field of science or research that is now developing. How does a baby in mother's womb get infected with coronavirus? Does the infection cross the placenta? How does it spread? Right? And does this represent a kind of a mutation? Is coronavirus mutating to infect the baby in the womb? Right? Because this is a serious development, especially if you're pregnant or if you have a wife who's pregnant. This is a serious problem, right? So that's what I'm saying. That's what I'm recommending. I'm Heerak Christian Kim, independent candidate for U.S. Congress of Virginia's 8th District. I'm a registered nurse, clinical nurse leader. I use evidence-based research to investigate, research, and provide recommendations. At this point, based on the data we have, if you don't want to take the risk of losing your baby and you're like 30 weeks pregnant, you should probably take time off from work. Or if you're 20 weeks pregnant, you should take time off from work. Because this particular mutation of COVID may not be in America yet. It could be. We don't know. We just don't know yet. It could be already here infecting people. It might have already killed people in America. It just, they might not have done the laboratory test to see, right? We don't know. And the question, another question is, can this happen earlier? Like, if you're like 1 week pregnant, 2 week pregnant, 3 week pregnant, can COVID-19 infection cause miscarriages, in the first week or second week, right? Because, I mean, if you have a miscarriage and after first week of pregnancy or second week of pregnancy, you're not really going to do a test on the fetus, on the baby, right? So the question is, how soon can this happen? Does it happen from the moment of conception, from zygote? Can zygotes get infected with COVID? We don't know, right? When does the infection happen? When is it possible to happen? We know it happens in 36th week. But the question is, when was this baby infected? Was it infected on the 36th week and died immediately? Or was it infected like several weeks ago and then it struggled to survive and it died after several weeks of struggle? How much pain did the baby experience? These are a lot of questions that labor and delivery nurses, nurse midwives, pediatric doctors, have to start studying and research, because this is a new field now. We know this happened. So we know that this can happen in America. As I said, COVID-19 is forever, like tuberculosis. Barring any miracle from God, you should assume that this is forever. This is permanent. So COVID-19 is going to mutate, and the mutation seems like it's a normal part of what COVID-19 does. And it's mutating to kill more people. And now it's killing babies in the womb who's completely surrounded by fluid. So how did the infection happen? How did your baby get infected? So if you're a pregnant mother and you're a doctor or a nurse and you want to be safe, you should stop working. Obviously, because I mean, this mutation of COVID may not be here yet, but it may be. We don't know. I mean, if you want to be careful and you have money saved up in the bank, the smartest thing to do is stop working now if you're pregnant, right? If you want to have your baby born safely, right? You gotta take precautions, right? Because COVID-19 is very real. The hospital said that it suspects there is a connection between the baby's death and the virus. The woman was 26 years old, young woman. The height of her fertility, right? 26. Well, not at the height. Height is more like 22, 23, 24. But at the end window of the height of fertility, like 18 to 24. Okay, she's a little bit beyond the height of the fertility window. So, had she been 22, maybe the baby might have survived, because at 26 you're kind of pushing the borderline. Because by 30, some women become kind of they have problem conceiving. So 26 is a little bit old. Eggs are a little bit old. They're 26 years old, so that may have something to do with it. So the woman 26 has a mild case of virus, so it's probably asymptomatic. She has it, but she's not really showing signs or symptoms of it. But as you know, asymptomatic COVID can infect you, and you can actually develop very serious case. I mean, the scientists have talked about that for months, right? So that could happen with the baby too, right? Mother has asymptomatic or not very serious case of COVID, but after the infection, the baby can die. Obviously, serious enough for the baby to die. But not all babies die, right, with COVID. So, yeah, so I mean, babies can have different levels of infection as well, right? So, yeah, but if you're a pregnant mother, I would recommend that you take time off from work if you have the money to do so. Like, obviously, if you don't have money and you need to work to keep a roof over your head, then you have to work. I mean, right? Because, I mean, yeah, you may lose your baby, but I mean, if you stop working, you're not going to be able to feed yourself, right? I mean, you have to work. There's no choice. Especially if you're like working for minimum pay, when it's $7.50 and not $15 an hour, you may have to work. But let's say, you are a medical doctor and you have a couple million saved up in the bank, or your husband is working and he's making enough money for both of you. It may be the right or smart decision to take time off from work, right? Because, when you rest at home, your child has better chance of survival, right? If your child is sick in the womb, because your health level and condition is directly related, how much rest you get, is directly related to how healthy and how the well-being of your baby that's inside your womb, right? If you're getting like 3 hours of sleep when your baby's pregnant, I mean, who knows what's going in there? You talk to, your labor and delivery doctor, but as you know, COVID-19 is new, so your labor and delivery doctor probably will not know what the heck is going on in Israel, most of them. So this is not normal issue. It's an extraordinary issue brought on by COVID-19. So that's why I think you should take my recommendation on this and stop working if you have enough money saved up. Yeah, let's say you're like 35 and if this is your first pregnancy, do you really want to lose your child? Because it's, what I mean? If this is coming to America, I mean, do you really want to take that risk? Um, I mean, you do what you want. It's your life. But if 35 is really old, you know what I'm saying? I mean, for pregnancy's sake, you might have had like 4 different miscarriages before you got pregnant at 35. Because, average woman who's like 35 has, may have several miscarriages before, not miscarriages per se, but, have difficulty getting pregnant, because your eggs are like 35 years old. They're old. Like, optimal time to get pregnant is like, what, 18 to 24, right? When you pass 30, you're going to struggle with pregnancy, and not only getting pregnant, you're going to struggle with keeping the pregnancy. You can lose your baby after a few weeks. So you got to be very careful. It's kind of precious, right? When you're getting married and have your first child pregnant, your first pregnancy at 35, you're taking a lot of risks there. And do you want to lose your child after 36 weeks of pregnancy, like a couple weeks before the baby's born? I mean, you know what I'm saying? You know what you want in life. You know what makes you happy. You decide. It's your life. But my recommendation is that if you're a mother pregnant, even if you're 26, because we see that this woman's 26, you should stop working if you have enough money saved up. I mean, obviously, as I said, with less than $15 an hour minimum wage, most women cannot take off from work. Unfortunately, but that's why, Tin Man Joe doesn't have a heart. You see why I don't like Tin Man Joe? Tin Man Joe doesn't have a heart. He doesn't care about you. He doesn't care about your family, because this $15 minimum wage is related. Like your husband making $15 minimum wage and you making $15 minimum wage, combined is $30 an hour. It's a big thing. And that's why Tin Man Joe doesn't have a heart. And I hope you vote him out in 2024, because he's Tin Man Joe. He didn't give you what he acted like he was going to give you, right? Minimum wage at $15, right? He could do it, but he doesn't want to do it because he doesn't care about you. I care about you. That's why I created this show. So vote for me on November 8th, 2022. Send me to Congress so that I can help you and your children. And I'm not going to do it like, oh, COVID-19 doesn't exist. Oh, let's open up everything and everything's going to be okay. We're going to be normal again. I'm not going to take that like fantasy route. I'm going to deal with the reality, solve the real problems that exist in our country, solve real problems that exist in your family, like minimum wage under like $10. I'm going to be solving real problems, right? Because you are real. Your life is real. Your baby in your womb is real. Hopefully it's alive and doesn't have COVID. And your problems are real. So we have to solve these problems, So we have to deal with reality. And that's what I'll be doing. That's why you should vote for me, Heerak Christian Kim, for U.S. Congressman versus 8th District. Yeah. So visit my website, www.heerak4congress.com, and learn more about me, and make sure you vote for me on November 8th, 2023. So it's still a couple of years away. So no stress, no hype. That's why I didn't go to CPAC this year. But but anyway, yeah. So I guess I'll see you next time. But hopefully this show helps you and your family. And if you're pregnant, I hope my advice and you're taking my advice will result in you delivering a healthy baby and not a stillborn dead baby at 36 weeks. I hope that you'll be well and that your family will be well. Bye. See you next time.